Tybost is used to increase the levels of certain HIV protease inhibitors, atazanavir, and darunavir, to help control HIV infection. It is not a cure for HIV infection. To decrease the risk of spreading HIV disease to others, continue to take all HIV medications exactly as prescribed by your doctor. Use an effective barrier method during sexual activity as directed by your doctor. Do not share personal items that may have contacted blood or other body fluids. Consult your doctor or pharmacist for more details. Before you start taking Tybost, make sure to read the patient information leaflet from your pharmacist. Take this medication by mouth with food as directed by your doctor, usually once daily. It's important to take Tybost at the same time as your HIV protease inhibitor. Make sure to continue taking Tybost exactly as prescribed by your doctor. Do not skip any doses and take it at evenly spaced intervals. It's best to take it at the same time each day to help you remember. Do not take more or less of Tybost than prescribed or stop taking it unless directed by your doctor. Doing so may cause the amount of virus to increase, make the infection more difficult to treat, or worsen side effects. If you experience nausea that lasts or gets worse, make sure to let your doctor or pharmacist know right away. It's important to remember that your doctor has prescribed this medication because they believe the benefits outweigh the potential side effects. Many people who use this medication do not experience serious side effects. As your immune system strengthens, it may start fighting off infections you already had, which could cause disease symptoms to return. You may also experience symptoms if your immune system becomes overactive. This reaction could occur shortly after starting HIV treatment or even many months later. If you experience any serious symptoms such as unexplained weight loss, severe tiredness, muscle aches that don't go away, or any other concerning symptoms, seek medical help immediately. If you experienced serious side effects such as persistent nausea or vomiting, loss of appetite, stomach or abdominal pain, or any signs of an allergic reaction, contact your doctor right away. And if you notice any other effects not listed here, it's important to speak with your doctor or pharmacist. Remember, this is not a complete list of possible side effects, and it's important to seek medical advice if you have any concerns. Please consult your doctor or pharmacist for further information. Before taking Tybost, it's important to inform your doctor or pharmacist of any allergies you may have, as this medication may contain ingredients that could cause allergic reactions. It's also crucial to discuss your medical history, particularly if you have kidney disease. If you are planning to have surgery, make sure to inform your doctor or dentist about all the medications and herbal products you are currently using. It's important to note that Tybost is not recommended for use during pregnancy, as it may not work well in pregnant women. If you become pregnant or suspect that you may be pregnant, notify your doctor right away. Your doctor may need to adjust your HIV medications. Additionally, it is unknown whether Tybost passes into breast milk. Since breast milk may transmit HIV, it's important to consult your doctor before breastfeeding while taking this medication. Always follow your doctor's advice regarding the best time to take Tybost. When taking Tybost, it's important to be aware of potential drug interactions. This medication can slow down the removal of other medications from your body, which may affect how they work. Some products that may interact with Tybost include elvitegravir, orlistat, and ritonavir. Additionally, other medications can affect the removal of Tybost from your body, which may affect how Tybost works. Examples of these medications include certain drugs used to treat seizures, enzalutamide, certain HIV NNRTI drugs, rifampin, and St. John's wort. It's also important to note that Tybost may decrease the effectiveness of hormonal birth control. If you are taking Tybost and using hormonal birth control, talk to your doctor about additional or alternative reliable forms of birth control. It is also recommended to use an effective barrier method during sexual activity to decrease the risk of spreading HIV to others. Lastly, do not take Tybost with other products that contain cobicistat. Always consult with your doctor or pharmacist before starting, stopping, or changing the dosage of any medicines. If someone has taken too much Tybost and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek medical help immediately by calling 911 or contacting a poison control center. In the U.S., residents can call their local poison control center at 1-800-222-1222, while Canadian residents can reach out to a provincial poison control centre for assistance. It is important not to share Tybost with others. Before starting this medication, your doctor may conduct lab or medical tests, such as checking your kidney function. It is important to attend all medical and lab appointments. Be sure to consult your doctor for more details on the uses and benefits of Tybost, as well as the recommended daily dosage and optimal timing for taking this medication. If you forget to take a dose of Tybost, take it as soon as you remember, unless it's less than 12 hours until your next dose. If that's the case, don't take the missed dose and just take your next dose at the regular time. Don't take a double dose to make up for the missed one. It is important to store Tybost in its original container at room temperature, away from light and moisture. Avoid storing it in the bathroom and make sure to keep it out of reach of children and pets. When it comes to disposal, do not flush Tybost down the toilet or pour it into a drain unless instructed to do so. It is best to properly discard this product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.